Dr. Michael Orr with Eye Surgeons of Indiana, and we're going to talk today about the light adjustable lens. And this is groundbreaking technology that allows precision that we've never had before for results after cataract surgery. So I had the pleasure of being with Sharon here, and Sharon and I have known each other as patient and doctor for well over 20 years.
Yes.
So as a highly nearsighted patient, she had successful LASIK, and that was, Sharon, in what, 1999?
Late 90s, yeah.
Yeah.
Yes.
And with regard to your LASIK, did things go well for a lot of years?
Yes, very well. I chose the monovision a little bit. My correction was so significant, I wasn't sure I was going to be able to do the monovision very well. But the LASIK was pretty successful, and I was very happy with the results there. The only thing I ever had as a concern with the LASIK was a little bit of dry eye. That was the only thing that ever bothered me. My vision at a distance was good. My reading distance was excellent until I got older, and then that started to fade a little bit. So I was real happy with that.
The idea of cataracts and having a result that would leave you with glasses wasn't your first choice, is that right?
Right. I had started to need reading glasses just a little bit. Just the possibility of being able to do away with all glasses. I've worn glasses since I was in second or third grade, as you mentioned. I don't even remember a time when I didn't have some sort of visual aid. I don't. So being able to get rid of the glasses altogether was great. I know vanity plays a part in that, but
well, it's practical
it is. It's very practical.
There's a lot of reasons, but
so much more convenient than some of the other options. Yeah.
So as Sharon progressed in her cataract influence on her vision, just with loss of sharpness and losing distinct vision and night problems, we talked about the light adjustable lens, and at that point it was unavailable. And I'm going to compliment Sharon here about she was so interested in precision vision that we postponed things a number of times with cataract surgery to wait for the lens. So I guess about June sometime, we did surgery on her left eye using laser-assisted surgery and implanting the light adjustable lens in one of the first ones done, in the Midwest. And Sharon, I think things went pretty well. You saw fairly well after the implant right away.
Right away. Actually, the distance vision was excellent in both eyes right away. I noticed that, and I started wondering, should I leave it that way?
Yeah.
But then, no, my desire to have the ability to be able to read price tags and, content lists on the back of groceries and things like that. So we decided to make that change. But it was really amazing to have that sharp of distance vision when I wasn't expecting that at all.
We started our treatments about 2 weeks after surgery. And we had a discussion about where we'd like to have you focus. So explain a little bit. We did the treatment, about a 2-minute treatment. Did you notice an improvement after the first treatment?
I did. It was almost right on target after the first visit. And I started, it took a couple of days for it to really clear completely up, and I did have a little bit of that rose glow in that eye for just a short time. But it was almost exactly where I needed it to be. It was, books and things out about here were perfect. And I had decided that my Fitbit was going to be my guide for where I wanted my vision to be. And if anybody wears a Fitbit, they know that the steps that appear at the top are tiny little print. So that was my goal.
So after the first treatment, what we do frequently is we really get into fine-tuning the vision even more. That's a very good example. And we do that by checking your vision and finding out, do you want to be just a little more nearsighted or a little less? And we can then adjust it a second time and even a third time. So after the second adjustment, you felt pretty comfortable where you were at?
Absolutely. And a bonus here with this, excuse me, is that the visions at a distance seem sharper as well. Even though I know that it is my right eye that is dominant for distance, I still feel like I see very clearly at a distance.
The thing that I want to emphasize more than ever is for the patients that have had previous refractive surgery, the only way to be precise, to be able to dial it in exactly at distance or at near, either in post-LASIK or post-radiokeratotomy, is the light adjustable lens. And this is a great addition to our practice. And Sharon, you are the model patient, and I just look for other patients to be successful, but you may top the list.
Well, the procedure was great. I mean, there was no discomfort. It was quick. The staff was wonderful. It was just a good experience.
Yeah, I appreciate it.
I'm selling the benefits of Eye Surgeons of Indiana all over my friends and everyone that I know.
We appreciate it. Thanks for being such a good patient.
Sure. Thank you.